May is Skin Cancer Awareness Month. USA Health Mitchell Cancer Institute is hosting the Hope Cup Charity Golf Tournament. That is this week, and this is an event that raises money for melanoma and skin cancer research. So we have Dr. Harrison Howard in the studio to talk more about prevention, early diagnosis, and treatment options. You know, it's a beautiful day outside, lots of glorious sunshine. When you see days like this, do you think, oh, I hope people are protecting themselves?
Absolutely. I think living in Mobile and the Gulf Coast area, it's so important to keep sunscreen in your car and to wear it, particularly on nice sunny days like today. And if you're at the beach or playing golf or doing yard work, wearing an SPF of 30 or greater is really important.
Yeah, I want to go right down the line here in talking about prevention. Obviously, that SPF clothing is important. And you also say, you know, putting on the sunblock with that too.
Absolutely. You can't do too much. Things we recommend to our patients are wearing sunglasses, wide brim hats, particularly for people that have had melanoma. Another really big issue is to avoid tanning beds. There's a lot of data coming out suggesting that that is contributing to more skin cancers.
Now, with other things, they talk about moderation. Is it the same for melanoma? Can you just say if you only do X amount of time in a tanning bay or X amount of time on the beach, you should be okay?
I usually recommend stay away from tanning beds completely. We live an active lifestyle in this area, so it's okay to be outside, but you just have to take proper precautions. One of the things I emphasize is remembering to reapply sunscreen. So if you're swimming or sweating, it'll wear off. It only lasts about 2 or 3 hours, so you got to remember to put it on every couple hours. You can't just do it once and think that you're good for the day.
Okay, so talk about diagnosis here. You need to have a doctor do that for you.
Generally speaking, yes. So most of the time a dermatologist or a primary care physician will do a biopsy of a suspicious lesion. The thing I like to talk about are the ABCs because it's easy to remember. A mole that's asymmetric is A, B is an irregular or jagged border, C is color, moles that are changing color, they're dark black, blue, D is diameter, so bigger than about a pencil eraser, and then E for evolution. Anything that's changing. Is it growing? Is it bleeding? Is it changing color? Those are the things that should get your attention and get in for a biopsy.
Okay, and then you get in for that biopsy, the doctor tells you yay or nay, and then treatment.
Correct, and as a surgical oncologist at the Mitchell Cancer Institute, I have a personal interest in melanoma. It's something that is a big part of my practice that I specialize in. Typically when people are diagnosed with a melanoma, a surgical oncologist like myself will take care of it. Some of the very, very early disease a dermatologist can take care of. Dermatologists are more likely to take care of the more common types of skin cancer like squamous cell and basal cell, but melanomas typically will come to a surgeon or a surgical oncologist.
Full of information. I appreciate your time. My goodness, we could go on and on. Listen, we have the information up there for the annual golf tournament that's coming up. It's Hope Cup, and I want to thank you, Doctor, for stopping by. Important information here.
Thanks so much.
All right, and listen, we'll have this interview posted on the Fox News YouTube page in case you want to watch it or share it with someone you know, and subscribe to it.